So male pattern baldness, really common, genetically controlled by hormones. And this is the Norwood scale. This is how we classify what stage of male pattern hair loss you are in. Male pattern hair loss is due to testosterone being converted into a substance called DHT, which binds to a very specific receptor on hair follicles, and that receptor is only located on the hair follicles in the frontal and the top of the scalp. It does not impact the hair follicles along the side and the back, which is why we see this progressive pattern of hair loss in men. So it is related to the conversion of testosterone to DHT and the binding of it onto those receptors. So male pattern hair loss, we want to block the binding of that DHT conversion from binding on to those follicles to keep them healthy and keep that signaling pathway going. And one of the most common ways that's done is with a medication called finasteride, which can be taken orally or topically. The other way we can do it is PRP, our platelet-rich plasma, which we are using your body's own growth factors to supplement and stimulate that cell signaling pathway between those two areas of stem cells that I talked about before. So that's how PRP is going to work. It's going to supplement that pathway to keep those follicles growing and prevent that miniaturization process from happening. Once we reach, however, these stages where we've had complete loss of follicles and the follicles have died, unfortunately, we cannot revive ones. So we can't revive follicles that have already gone through the process of miniaturization and essentially died. Once they're gone, and then we're going to be looking at different processes like our follicular unit extraction hair transplants or camouflage with micropigmentation. So it is important that we intervene early and we get this hair loss in the early stages so we can get on top of it and salvage as many follicles as we possibly can. Anything that we're going to do PRP or topically must be maintained because we can't change, at this point, we can't change your genetics. So we just need to continue to maintain the health of those follicles. So female pattern hair loss tends to progress in a different pattern than men, and that's because our follicles are different, those receptors are different, and we tend to have obviously a different genetic pattern. So women tend to see this overall loss and separation, a widening of their part with loss overall, and then leading to this kind of vertex and frontal loss in a different pattern than men. So in women, we know that minoxidil, topical minoxidil, is going to work really well in these early stages, and that is one of the components in our 82M. They're also going to respond really well to our shampoos, our low-level laser light, and our PRP therapies. Frontal hair loss tends to not respond as well to minoxidil. So female pattern hair loss tends to respond really well to topical minoxidil, which is one of the components in our 82M serum, as well as our 82S shampoo. But we know that frontal temporal hair loss, most commonly seen in men, does not respond well to minoxidil. The frontal needs finasteride, which is one of the components of 82F. Women, however, cannot have finasteride and cannot be exposed to finasteride as it does cause birth defects. So no 82F for women. Women also tend to respond really well. There's a great study just published on PRP for female pattern hair loss, stimulating that cell signaling pathway. So again, another great option for women is our PRP, as well as our low-level